My goal here will be to show, so I will use a lot of pictures. The goal will be to describe what we saw and what we've been continue to see as far as the clinical presentations of those cases associated with Seneca, and so we'll move forward with that. So I'm calling here the Seneca-Associated diseases because, I think it has been briefly talked about before, that as of now, there's a lot of associations and a lot of consistency in association of the virus with those cases, but as of now, to the best of our knowledge, the Koch postulate has not yet been completely fulfilled. In other words, we still need to be able to inoculate the virus in pigs and replicate some of these things that we are seeing here. So I'd like to acknowledge other collaborators from my state, from Minnesota, and also from Brazil that helped to put those information together. Really a lot of people involved in that investigation, and I'm confident that week after week we are learning bit by bit, but moving forward to better understanding the association of this virus, the Seneca virus, and those clinical presentations. So we start here with a slide to represent what we saw in Brazil. We are really talking about two different syndromes. One being the vesicular disease itself, with a lot of foot lesions, coronary band lesions, foot pad lesions, and also vesicular lesions, especially in the snout, as you can see the pictures here. And so the vesicular disease going on mostly in finishing pigs, but also in some sow farms. And in sow farms, in pretty much at the same time that we saw those lesions going on in the sows, we also saw this other syndrome that we believe it's somehow connected and associated with the vesicular lesion, which is the neonatal mortality. So we are talking about two things going on, and in both cases, what we've been finding in those cases in terms of infectious agent is Seneca Valley virus, and only Seneca Valley virus if you compare all the breaks that we'll talk about. So we've proposed this terminology to describe the neonatal losses, epidemic transient neonatal losses. Epidemic because it's really a sudden onset. Mortality goes up to not all cases to 70%, some cases 30, 40, 50, but up to 70% we've seen. And transient because it's a self-limiting mortality going on. So after about a week, mortality just comes back to baseline, whatever it was before. And it's neonatal because it's really only the pigs that are being born that day, the 1 day old, 2 days old, up to 3 days old piglets that are dying. The piglets of 4, 5, 6, 7 days, they develop some diseases, some die, some don't. But consistently, the piglets of more than 1 week of age, they just don't develop disease, they just don't die. We do know that they do get infected, as they are positive by PCR if you screen those. We're going to talk a little bit more about that in a little bit, but they do not develop this mortality. And Dr. Vanucci, as well as other pathologists in Brazil and also here now in the United States, have looked extensively to those piglets, trying to find what are the lesions that those piglets are developing, just try to understand what's the cause of death of those piglets. And up to this point, there is no consistency. We do not know yet why those piglets are dying. Looking in complete histopathology work from the brain to the intestines, to the lungs, to the lymphoid tissues, just can't find up to this point reasons of try to explain why those piglets are dying. But even though we're talking about some variability here from 40 to 70%, 10 to 7 days to self-limiting disease and this variation of piglets, within this, even with this variation, it's pretty consistent that it has this epidemic component. It is transient, it really goes away, and up to this point, we don't know of any farm that rebroke, that had that neonatal mortality, and then down the road after 1 month or 2 or 3, and we are now some 10, 11 months from the first case that we know of, we're not aware of any rebreaks. So whatever, it has been really epidemic, transient, and infecting only those neonatal piglets. In Brazil, putting together, talking with different production companies, different veterinarians, different research institutions, with the Ministry of Agriculture themselves, we do believe that some 70–80% of the Brazilian industry had experienced those neonatal losses up to this point, or the vesicular disease component that we're going to talk about in a little bit. Just said that we're not aware of rebreaks, and well, just talked about that. And here it describes that, tries to put here in a timeline how the disease spread in Brazil. Just a quick background here. Pigs are in this region. There are no commercial pig production in the north part of Brazil. Only to draw the line here, it's pretty much a line from here south. That's where the pigs are, and that's where we saw the problem. So starting here in yellow and going to red as time goes by. Started in the state of Minas Gerais in September last year. And then soon after that, in October, we saw some cases in this area called Goiás. Then in this second area of Minas Gerais state, then saw that moving to the state of Paraná. Soon after that, in Mato Grosso do Sul. Then before Mato Grosso do Sul, São Paulo, and then Rio Grande do Sul, and the last state that was infected was the state of Santa Catarina. Calling here infected, but at least that reported the syndrome going on. And this area here is pretty much the Iowa, Minnesota of Brazil in terms of pig density. So it's the most pig dense area is this region right here. So in a nutshell, what I'd like to show here is that it really spread really fast. So if you think here, it started in September, October, November, all those states, and then after a few more months, all the other states on the south of Brazil were also infected, and we're talking about some 70% at least of the Brazilian industry that was affected. So it really did spread really fast. In the US, outbreak could show, really similar pictures. Snout lesions, coronary band kind of lesions in the south, and also the piglets, the neonatal mortality going on. Pretty much, it's very strikingly similar to what we saw and described in Brazil. We know that it has been circulating, the Seneca has been circulating in the US since at least 1988, as far as the USDA records show. And this summer now, in 2015, there is an increased number of reports in different states here in the Midwest, at least, that we are aware of, between the cases from Iowa, from Minnesota, and talking to practitioners. We understand that vesicular disease was reported in exhibit pig cases in at least some 8 county or state fairs. In finishing pigs, showing clinical vesicular disease going on, some 15 cases, or finishing sites reporting this. And in sow farms, we're talking about some 40 cases. And it's important to mention that not all sow cases are associated with the vesicular lesions in the sows. We might have some, and we did have lots of examples in Brazil that we only saw the neonatal mortality, and hard to tell if the vesicular disease was not there, if it was almost subclinical, it was really minor, if it was But anyways, it's good to consider, it's important to consider that not all sow farm cases will have the vesicular disease and the neonatal mortality. But at least the neonatal mortality is what we are reporting here. And, in a nutshell here, not to spend much time, putting together data from Minnesota, from Iowa, and from North Carolina, we understand that the Seneca RNA detection by PCR is prevalent, but it's at low prevalence. We're talking about 1%, sometimes less, sometimes up to 3%, depending on the sample. So we understand that Seneca is being circulating in the US. So some pictures here to share with you guys. Vesicular disease, you see here, vesicular disease in a young pig, in a sow, in actually a gilt, sow or gilt, don't remember this one, but anyways, more snout lesions, and you see that the lesion from here, to this point where it's really active and new, to this point here or there, that it's already, it bursts and kind of start healing. It's all this thing happens in a few days, 2-3 days. After a week, you have a hard time to find anything in this piglet here if you miss the first vesicle. So it's really fast and self-limiting, and all these lesions, they really heal in a short time. There is an important variation in the lesion prevalence in both sows, nurseries, and finishers, as we just mentioned. So might have some sow farms that will report some 30-40% of the sows with some lesions, but also sow farms that didn't see or didn't report any lesion at all, only the neonatal mortality. So, more pictures. They're minor, mild, didn't really see a lot of severe kind of lesions, but as Dr. Terry said several times before, it's just impossible to associate this, to diagnose this without lab work. Really need to sample, even though it's minor, it's mild, it's going, it doesn't, we don't really know if it's going away until time goes by, so it's really important to sample and make sure that's not the other classic, 4 other classic swine diseases, vesicular diseases. Some more pictures just to show that those ones were kind of more active, and those ones were starting to heal. They really heal fast in 1-2 days, and some study being conducted by Dr. Chris Rademacher is showing that those piglet, at a population level, lesions took some, in a finisher in the US, lesions took some 2 to 3 weeks to heal, but pigs were still, virus could still be detected in that population, at least by oral fluids, for additional 2-3 weeks after lesions were gone. So it's important to consider that the virus might be there even after the lesions have disappeared. Some more pictures here on the neonatal mortality syndrome. We already talked about the duration. We are talking about the neonatal component. And just to remind here, it's something that, talking to farm managers and people from the barn, they say it's really, the neonatal mortality. Piglets develop a disease really fast in 5-6 hours. They really get sick, somehow dehydrated, lethargic, and they die, and they die fast. Within a litter, among all the litters, the prevalence is really high. Some of the litters that are farrowing, some 70-80% that are farrowing, they will develop this. And if a litter develop this, most piglets, some 90% or 100%, will die. So there is some variation there. Not all pigs do die. Some survive, but it's really high, the prevalence and the morbidity at the beginning. This picture is from here. Yeah, this one is from Brazil. This one is from here. So pretty much same clinical picture. Sometimes again we don't see any vesicular disease going in the south. So it's really a question of are we missing it because we're concerned with the piglets that are dying? Are we not looking at the sows? We do have examples both here in the US and in Brazil where we saw the neonatal mortality going on, and then ask the vet or the farm manager, hey, there is anything going on in the sows, any lesions in the sow? They say, no, not really, just the piglets, nothing special going on in the sows. And then okay, but just go back, please go back, because we saw that in other farms. Important to rule that out. So just double check, see if you find something on the sows, and then they eventually come back and say, hey, yeah, the sows really had something funny in their nose, some sort of lesions, really, really minor, but as you asked to check, we double checked and we did find something. So, regarding the lesions in the sows and how it relates with the mortality, it's yet to be determined, but seems to have a strong association there. Some data that we put together with some initial investigation and comparing herds that developed this neonatal syndrome compared to close by herds that did not develop, at least clinically, the syndrome. We could see that piglets, those kind of piglets that were dying, most of them had their stomach full of milk, some 85%. It's really consistent. Different investigators assessing, some 85% of the piglets, they do have the stomach full of milk. Piglets become just like that in the picture. They are lethargic, they are dehydrated. In about half of the cases, it's yes, from some picture here you could have noticed that there is some diarrhea going on, but not in all cases. And in a lot of those cases that, along with mortality, there is also diarrhea. The diarrhea is a frequent finding. The diarrhea is a mesocolonic edema with so detection with C. diff over there, and we don't know at this point if it's secondary or if it's playing a role. But as not all cases, remember that some 50% of the cases do not have diarrhea. We're hard to interpret what's the really role of C. diff in that, but it's striking that that's a frequent finding. Mesocolonic edema with those kind of piglets. And so in most cases, some vesicular disease going on in the sows and no apparent reproductive impact on the sows. They really seem to be affected with increased repeats or reduced farrowing rate or something like that. It really is something that happened with the piglets. As time goes by, the herds seem to go back to normal. So as a summary, we have two things going on here, vesicular disease and the neonatal losses. Vesicular disease is mostly, the high morbidity in finishing pigs, less morbidity in sow farms, but actually the mortality itself associated with this, to our understanding, is practically, it's zero. Pigs are not dying because of this. They recover fast, but they still they're positive for the virus for additional 2-3 weeks, and it's key the communication with health officials or power plants. And as far as epidemic transient neonatal losses is concerned, high morbidity within litters, high mortality with those early days piglets. What else? Comes back to normality in 4, 5, 10 days, about a week, and we do know that that healthy piglets, the ones that are not with the clinical disease, they could also carry the virus. Seneca Valley virus, so if you look at the literature, there is a lot of consistency on the association of Seneca with vesicular disease, but not really for the neonatal losses. So understanding the Brazilian experience was the first large known outbreak associated with Seneca, and now we are investigating that, and if it's Seneca really causing the neonatal losses, next question will be which Seneca, and is it really Seneca, or are we missing something else that are playing a role? It's still puzzling that we don't find lesions associated with those neonatal losses. So it's important to keep in mind that there might be some other agents, infectious or not, playing a role in that mortality. Assuming that it's infectious agent, if it's Seneca or Seneca with something else, it's highly transmissible. We saw the map. It's should be highly immunogenic, and it established a protective, long-lasting immunity, as it only lasts for 4 months and there is no reports of rebreaks. And if Seneca has changed, how to define new versus old, are there markers? We're looking at that, and with the growing number of cases, with growing number of samples that are being genotyped and associated with the clinical, what we see in the field, we'll be able to cross those that information and be able to somehow gain knowledge in those things. Don't know how it was transmitted. Pigs, of course, might play a role, but from our understanding, experience both here and in Brazil, in some cases, pig movement just don't explain how the farm got infected, as we saw this thing coming in farms that are really closed for a long period of time and still experience that. So we should be considering some other routes of transmission other than pigs themselves. So moving forward, to be able to address those questions, we have ongoing studies here following individual piglets and sows, both affected and from non-affected litters over time, to be able to have a better understanding of shedding the sow farm level, and also in the finishing site level. We'll try different, working in collaboration and really close down there in names with the USDA team and the Iowa State team. Will be developing infection models to understand not only the cock themselves, not only try to reproduce those syndromes with the gestating sow model and the finishing pig model and the growing pig model, but also do some basic research to try to understand dynamics of infection, seroconversion, and immunity. Even if we don't see disease, it's going to be important to document those dynamics. And keep developing. I think Dr. Vanucci is going to spend more time into this, but we're still making a lot of progress in development of diagnostic tools. We already have PCR, already have Dr. Vanucci developed the in situ hybridization, and there are some other stuff going on and being validated. For example, serology and immuno IFA, IHC, and so we're still developing the tools necessary to further investigate both retrospective and prospective cases, and we are moving forward week after week.